I'm really excited today to be joined by Dr. Natalia Chalmers, who has seen the dental system from essentially every side. As a dental officer at the FDA, as the first ever chief dental officer at CMS formerly, where she shaped national oral health policy, and now as head of clinical innovation at Overjet, the biggest dental AI company in the world. She is a pediatric dentist and oral health care policy leader and the 2025 Pediatric Dentist of the Year. Dr. Chalmers, welcome to the show.
Thank you so much for having me. What a pleasure to join you.
Absolutely. Really excited to chat about so many things. We don't have enough time to kind of go into all of that, but I'll kind of start with a question that if you are in healthcare, all of us get the question all the time. What kind of drew you to healthcare and then obviously oral health and pediatric dentistry in particular? When you were young, what was the thing that kind of pulled you towards that?
I think very early on, I became aware of the importance of poor oral health to people's life, right? And there was like, oh, what's the solution? But really, one of the biggest change in trajectory for my career is why I became a pediatric dentist. I was on a mission to cure dental caries, and that's no joke. That's why I have a PhD in microbiology. I really wanted to understand what's driving these two main diseases, right, that are such a burden to so many. And something really fundamental happened that changed the trajectory of my career. In 2007, I'm in Maryland. A beautiful 12-year-old Diamante driver died in the state of Maryland from a tooth infection that turned into a brain abscess, right? And I think it was the first time I had a real pause. It was like, Diamante didn't need the latest innovation I was creating in the lab. He needed an $80 extraction that was going to save his life and access to care. And then the University of Maryland just immediately, with the help of the legislator, expanded training for general dentists who were not seeing a lot of the children, right? And they did this like mini pediatric residency, and I took it and I was like, oh my God, this is where I need to be and be part of the solution. And then I obviously did the full residency. But I would say this was the first time, from a very focused basic science approach to like, let's move forward to where there is a leverage point where you really can change care for many, many people, not just one patient. I love clinical dentistry, love my patients, right? But this was the first time it's like the system needs solutions that touch many.
Yeah, that's such a heartbreaking story, but unfortunately, that's a reality and still a reality for a lot of people. They're
Yes.
maybe not dying from a brain abscess from it, but I see it in the ER all the time where, unfortunately, even if you have health insurance, you may not have great dental coverage and people come in and, the best we can do is, maybe treat the pain, maybe start them on antibiotics and whatnot, but they need a dentist and getting into a dentist is unfortunately in a lot of cases so difficult, which should not be the case because, healthcare is healthcare. That includes oral health, that includes every other part of health. And it's unfortunate that we, separate it into its own category and it can sometimes be difficult for patients to get the care. So such a heartbreaking story, but then, you took action and you used it to, help create positive change, which is great to hear.
I'm just
When
so amazed you mentioned the emergency department. If you could just one piece, because it's such an important continuation of the story, right? The same state, 10 years later, the adults on Medicaid. So we did amazing things after that tragedy for children. Rates increased, provider, and like amazing, amazing things. But 10 years later, adults still didn't have coverage. And to your point about the emergency department, actually the legislator passed the bill to do a study about the emergency department, how much money we were spending. And here I have to give a big shout out to the Maryland Dental Action Coalition because it takes a lot of people. You need, the clinician voice, you need data, you need analytics, you need advocates, you need lawyers to write, the legislation. Anyway, just to finish the story with the emergency department, I testified to the House and Senate in Maryland as part of this effort, and we showed that still 15 adults in Maryland had died. Adults, not children anymore. And the state was spending something in the order of $246 million a year in the emergency department, to your point. They're dealing with real emergency. There is only so much you can do in an emergency department. And obviously, because pain management is very important as part of that, the counties with the highest rates of emergency department visits were also the counties with the highest rates of opioids death. And so just the legislator heard it and the bill passed unanimously. I think this is just such an important message, because nothing passes unanimously anymore, but we can agree that oral health matters for everyone. And now today, as a result of this work, 800,000 adults have coverage. 800 adults. To your point, is you can't change policy. You just need the right evidence in front of the legislator with the right narrative to show that this, as you said, it's whole health, and it costs. If it's not addressed, it costs to the healthcare system quite a lot.
Yeah, it's all connected. Just because we may not choose to cover it, it's still going to impact everyone, even if you don't have dental issues and you have the best dental insurance. That's so great to hear. I love that Maryland has actually taken the steps to kind of address these issues. Unfortunately, fortunately we're 50 states, but sometimes unfortunately we're 50 states, and I'm in Texas. Unfortunately, we haven't passed anything like that, so we have to continue pushing. But like you said, the fact that it passed unanimously, it shows that dental care, it's not a left or right issue. It impacts everyone. So we need to continue to have those conversations and advocate. And I personally have a background in poli-sci. I love advocacy. It's something I'm very passionate about. And obviously I can already tell that you are passionate about that too. So tell me about when you realized that the power of policy and being involved with government and getting in front of them was important. And obviously you started with that story of unfortunately that boy who passed away and the legislature taking actions. But when did you realize, like, oh, I could actually do this as something that where I could work at FDA, work at CMS, this could be something that's a bigger part of my dental practice essentially?
Yeah, I think the getting the clinical training was incredibly important, because I would say one of the most effective advocacy works that I've seen is when it really comes from a place of authenticity but also experience, right? When I was, the Maryland story testifying, it was because, I was on call at 3 a.m. getting to the emergency department, and I was like, oh, this kid is so fortunate. They have a pediatric dentist they can lean on. But that's not the reality across the board. It was really the first time I was like, you need all pieces in order to have strong advocacy. Data is very important. Very early on, I mean, I love clinical dentistry and the handpiece, but I also love data. And I was like, data alone will not tell the story. So you need the clinicians to be empowered with the data and to share it in a way that's relatable to people who may not know anything about this subject, right? And so it's part of that story telling. One of the actual first change, I would say, impacts was during my residency, when I realized how I trained in Maryland, very strong residency in evidence-based pediatric dentistry. And we questioned everything. It was like, what's the evidence? Why are we doing this? And just had incredible mentors who pushed me to say, clinical practice can improve. We are not, we're not at the top of the mountains. We can do better. And so what would it take? And I think that was really very formative in my thinking. I was like, okay, where is the data for this problem? How do I solve it? How do we then change clinical guidelines? And I think that initial experience of how you can impact clinical guidance, like, oh, but the next level is like policy and what people think about and how it's covered. And it was amazing at FDA to be, use all of that training and basically decide if a drug is safe and effective and it can enter the US market. The responsibility of this, I cannot, understate, because obviously this drug will reach millions of people. And how it happens is it happens with incredible team of people. No one can do it alone. I think that was maybe one of the most important learnings in all of this advocacy. You got to have the right people at the table. And at FDA, every drug is approved by, 10, 15 people team, that each one brings their expertise to the table in order to make sure that genuinely we have the safest and most effective drugs out there.
Yeah,
And by the way, it was the first time where I heard about Overjet. Believe it or not, this is 5 years ago. I was at FDA, and 5 years ago, no one was talking about AI. Now everybody's talking about AI, right? But 5 years ago, I was on the drug side, and our colleagues on the devices came to us and was like, "Have you guys heard about this company? It's detecting cavities on X-rays." And I remember saying, like, "This is science fiction. What are you talking about?" And here we are, chief dental officer and head of clinical innovation. Absolutely love the team and how fast things are moving in this space today.
Yeah, that is amazing, and I love how you said that bringing together the clinical training with the policy training, it kind of makes you like one of the best champions, right? The people that do it within dentistry, healthcare, any field really. That's where you can really understand the problem and then apply the levers of power and funding to actually make that change happen. And a perfect transition, so that's kind of where you first heard about Overjet. When did you first was that the first you had heard about AI being applied in your field, or had you heard, some research being done before that, or when did you realize that, a big technological shift was about to impact this field that you're in?
That was the first time, and it's a good reason because Overjet was the first to get a clearance from FDA on the algorithms to detect cavities. So this is again 5 years ago, first to get this clearance. And then now I obviously appreciate a lot more of what it took to get there, right? The work didn't start in, 2021 when they had the clearance. It started, years before of just recognizing how we do have a problem about variability and diagnostic, differences between providers. And instead of fighting it, I think it's acknowledging it. It was like, okay, what is a tool that can fix that can help us get there and do this better? I don't know if you've heard the story of our founder, Dr. Iman, but this was her personal experience, right? She went to a provider, another provider said something different. I would say that's the experience of many patients today. It's like, who do we trust? Who do we believe? And then just to have, a technology that can be that, independent, FDA cleared source of anchoring and say, this is, here's an x-ray based on what, on average 75 dentists looked at it. The algorithm says there is a cavity here. It's really changed the conversation between providers and the patients. We're no longer arguing if there is disease or not. You know what we're doing? It's like there is disease. Let's talk about the treatment options, because the treatment options are not one or two or three, right? We look at the evidence-based guidelines. How do you manage this? In children, especially children with low risk, with high risk, I have seen what the power of prevention is, and you can change the trajectory of oral health for a child, right? Someone who is really on a track to be very high caries risk, with mom and the kid together, and you put them on a trajectory for health. That's for a lifetime, right? And so the earlier you detect these diseases with this technology, the more impactful we can be in terms of prevention and what really works. But that was the first time, and for good reason. They were the first one on the U.S. market. Yeah.
Yeah, that's amazing. I remember, first it's crazy that was 5 years ago, right? Like it seems like we've been talking about AI for like a decade, and then you realize
Yes.
like, oh
Yes.
wow, it kind of hit the scene not that long ago in a practical way. But I remember this was maybe like 2 years ago. My brother kind of first mentioned to it. He was like, "Oh yeah, I went to the dentist and they have like this new AI tool where they showed me like, oh, these are like your teeth that are at higher risk and whatnot." And I had the same reaction. I was like, "What? That sounds like not it, like it's not real." And then I started looking online. I was like, "Oh wow, these are like validated technologies that exist." But for someone listening that maybe has no idea about the field, I know you all offer a variety of offerings, so I want to discuss each one of those. But the most practical kind of patient-facing one, patient goes to the dentist, they get their X-rays. Where does the AI kick in? What does it help with? And tell me about that process.
Yeah, yeah. And I think this is where, with all of this technology, just understanding how they even get to the market is so important. As a provider, I'm not adopting a technology. I don't know what it does, right? So to me, actually, lifting that curtain and understanding the rigor, the studies that need to be done in order for this technology to reach the market, very, very important. And the good thing about it, it's all public information, right? So if I wanted to go and look at the clearance, Overjet has today 11 clearances, right? So if I wanted to look at each clearance, the FDA decision is on the FDA website. The indications, the specificity and sensitivity. These are two really important parameters I want to talk about, because I think people either have unrealistic expectations or they just don't really know of what AI can do. But the experience today is really amazing, right? You sit on the chair, the x-ray is taken, the AI that is trained on other thousands of images then annotates your x-ray and says, chances are this looks like a cavity, this looks like a filling. Ultimately, the provider is the one that sets the diagnosis. AI does not provide a diagnosis. These are supportive tools. So I want to emphasize this, how important it is to realize that this is this is something that helps the provider. And one of the key studies to get on the market is you have to show that the AI helps the clinician. So the clinician, how they perform, and they have to perform better with the AI. Otherwise, it's not making it to the market, right? I mean, if it's not helping the clinician as a supportive tool. So that's a really important concept of how these technology in imaging and dental imaging are out there. The other piece that I really think is it's kind of a misunderstanding and maybe a confusion, because there's so many versions of AI of what's generative versus imaging. And I don't know if you've heard, people like, oh, so, I can put it in Chat GPT and it will tell me the same things. Like, no, 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 no. Like, these models that are FDA cleared, that are, validated, tested, logged. The other ones, can hallucinate and imagine. So I think this is a really important. It's not a generative. It's not creating an image of what it thinks it is. It's actually trained to recognize it. I find people are very confused between the two, generative AI versus this reference. But yeah, today you walk in, the image is annotated. And the other piece that's really changing dentistry now is we also launched Overjet Voice, and that's the ambient listening where you can have a conversation eye to eye with the patient, and then based on your practice, you can have a beautiful note as at the end of that. How many of us have stayed, after 5 o'clock, trying to put the notes and trying to really be as accurate as you can? But this one is, again, ambient listening. And as you know, in healthcare, some of the big healthcare system, this is becoming a table stakes, right? Doctors are not signing up contracts if there is no ambient listening, because that's such a burden. And I would just say it's really helped the communication between AI in general, between the patient and the provider, but also this burden of providers to do more with less time. And these tools are just phenomenal in all of that.
Yeah, absolutely. I couldn't survive without my AI scribe. I can't, I think back to a few years ago. I'm like, how did I even do any note, much less have all my notes done by the end of shift? And it's really amazing how quickly it's been adopted. One thing that like in the ER or traditional hospital, obviously lots of AI tools being rolled out, but like in my day to day, I would say like chart summarization and scribes are probably the most common things, and then some of the more kind of future looking things, or even like what you're saying, right, like image analysis and radiology tools, they're still being tested and piloted. I wouldn't say they're like fully out there where I'm getting AI reads. I'm still waiting for the radiologist and whatnot. It seems like dentistry is a little bit ahead of like the hospital setting, right? Like you guys are adopting AI a little quicker than other fields. Do you think there's a reason for that, or do you think it's just more nimble, or what do you think the reason for that may be?
It's something that struck me recently related to what you're saying. I had recently some medical imaging done, and I've actually never seen the image, right? It was always a report. And when I talk about the findings with my provider, they're like, oh, let me read the report. I'm like, but I want to see the image. That was
Yeah.
my curiosity. And I think this is where dentistry is just so different, is because for the longest time, we have used the x-ray as a primary communication to help our patients understand the disease, understand the level of disease, so the burden of disease they carry, but also how it changes. Because there is nothing more powerful, right, to have a kiddo that you've taken, cavity free, basically, for years of care, and then I don't know, they go off to college, and I don't know, they drink all the coffee and sugar, right, and then they come and they have all these new disease, right. We have used this to actually show the progression of disease. And these are tools. I mean, every single day we take x-rays and we communicate with our patients the findings. And based on this, we make treatment plans. So in a sense, it's such an inherent part of what we do. We couldn't do our job without it, because so much of the disease is hidden. And to your initial point, is like people don't appreciate it. I think it's because some of it is not visible, right? It's in the bone or the jaw, it's so abstract to say, like, what is the cavity if you don't see it or it doesn't hurt, right? Well, the x-ray, we use that to communicate the disease and how it progresses. And so that, I think that's the biggest difference, is we don't necessarily rely on, someone else to interpret this. We are trained as clinicians to interpret the findings and communicate them. But there's something so powerful when a technology comes along And even a 4-year-old can look at the screen, it's like, Mom, these are my cavities. Real story, right? And that we didn't have that before, right? We're trying to point little shadows and triangles on the screen, and we hope the patients get it, because as you know, the moment patients understand whatever it is that is ailing them, they are in some ways empowered to do something about it, right? And take action, find the right provider. And if it's all mystery and they have no idea, how will we expect any change in behavior? Or really, that example I shared with mom and the child, like mom saw the initial cavities and she was on it. I mean, she was flossing, brushing. And you know what? This is the other piece people don't understand. Early stages of this disease are reversible. If you put enough minerals, the little cavities go away. And that is just amazing to see. And guess what? The way we knew it is we took another x-ray, right? The initial one, she saw the cavities, we took another one later, and it looked better. And so this is so, for me, I see the x-rays as an empowering tool in communication, in treatment planning, and it's really something we do every day.
Yeah, absolutely. And you pointed out, and it's such a simple thing when you say it, I'm like, oh yeah, anytime you go to the dentist, they do the x-rays and then the dentist talks to you about your x-rays and points out various things. But I never show the CT scan to my patient or the x-ray unless they ask for it, then I'll pull it up and it's like a whole like 5 minute process and trying to figure out how to bring it up on the computer in the room and whatnot. So yeah, that's such an important point. And then when you obviously, I think especially nowadays, we're all about technology. We have wearables and
Yes.
all types of fancy gadgets. So then when you apply that level of technology onto that image, patients want to be empowered. They want to understand their body, and so
Yes.
it all makes a ton of sense. One other thing you mentioned earlier, and I was reading a survey I think last week where it was saying like most people, when they go to a dentist, like preferably you want to see the same dentist, but a lot of times you see a different one, right? They may be in a group, and you may not be seeing the same one each time, and having a technology like this, it makes that information very objective, right? So it's on the chart. There's obviously the dentist is still making the decision, but there's a level of support of like, hey, this was identified last time, and they can kind of rely on that. And so that way, even if you're seeing different providers, your history and everything on your chart is very consistent. And so I see it helping probably from that point of view as well.
Spot on. So absolutely the historical perspective, but the other piece that I would bring is in some of the cases where we see a lot of children in a family, right? Okay, dad is like very committed, brings all four kids. I mean, it can be confusing, like which one had which cavity on what tooth, right? Like to be able to actually communicate specifically and show them where the disease is, for something they could take home. I mean, that's a game changer, right? Like whatever happens in the office, yes, and then they have something to reflect on.
Yeah.
Beautiful.
So one of the things I was going to ask is like how are patients taking it? It seems like for the most part in a very positive way. It gives them ownership of their health information. They can kind of the kids can be a part of it. The parents know exactly what's going on. Obviously, as an adult, you know what's going on as well. But moving to the provider side, I guess obviously I'm like a tech enthusiast. I love all types of new technologies. I imagine there's many dentists like me, but are there others that are more hesitant or more kind of scared about the technology? Because you turn on, and this isn't exclusive to healthcare, you turn on the news about AI and a lot of stuff is scary or not so good. Tell me about that relationship with the providers and how they've responded to this technology.
Yeah, I think this is a really, pivotal moment that it's now becoming part of day-to-day work and operations. And I would say we see the whole spectrum, right? We see the early enthusiasts, like you and I are probably in that category. It's like any new technology that makes our life easier, sure. Well, I also see the ones who was like, I don't know what it does. I am, I want to understand. And once you take the time to educate our colleagues, and I've done this, multiple CEs and webinars, they're so much more comfortable, because I think one of the most um, scary things it is somehow is generating new information, that it's not like really analyzing the image. And once people understand this difference, right, we're learning a new language. What is AI, what it isn't? And I talk a lot about what it isn't, like this is not what this is. So once people understand it, they tend to really then move to next, okay, let me see how it works in my workflow. Because I would just say it actually is a lot more than just the technology. You have to make it work in your practice. You have to train your staff how to communicate about it, right? It's, as you know, technology alone is not sufficient. You need to have the systems in place to make sure that it delivers the best outcome. And this is where, again, having a team who is thinking about all of these aspects becomes really important. And in Overjet, we have a whole team dedicated to just supporting the providers with adoption. So I think we will go through this. But the other realities, we have never, in the history of dentistry, have a technology that's evolved so rapidly. Even when you think, oh, let's transition to electronic health record, or let's transition to digital radiography, things took years. This is taking, 5 years in the big scheme of things is really transformational and exciting. And I think we'll start to see on the patient side, not only like, oh, this is helping me, they would start to expect it. It's almost like, oh, what? When you go and have a mammography, now you can sign a consent. It's like, oh, do you want AI to read your mammography? It's like, how many people say yes? It's like, why wouldn't you, right? I think patients will start to expect this as like, okay, it's another set of eyes. Let's see what the consensus is. And ultimately, again, the provider owns that decision as a diagnosis.
Yeah, I'm sure not that long in the future, at some point, all of these or some of these AI technologies are going to become standard of care, where like just like in the hospital, like putting in a line. An ultrasound is standard of care, and if you're not using an ultrasound, people are like, what are you doing? At some point, it will be like, hey, if you're not using AI to analyze this part of something or a scribe or whatever the case may be, it's like, oh wow, you're like old school, and this is standard of care now. um, and I think a little bit of skepticism is healthy, right? Like that tells you
Absolutely.
that dentists and healthcare providers have a stake in it. They care about their patients. They don't want to release something that would potentially be harmful to them or anyone else. So a little bit of skepticism is always good.
Absolutely. And just to recognize, as I said in the beginning, sensitivity and specificity, very important concepts. I say it's like a smoke detector, right? You want it to catch every fire, but you don't want it to go every time you make toast. And so
Yeah,
this is really important. Like, oh, if someone comes and tells you my technology is 100% sensitive and 100%, you better run, because that does
yeah.
just not exist. It doesn't exist in mammography, it doesn't exist in dentistry. And so really, this is why I say what it isn't. Recognizing the boundaries of this technology and how you need to have the guardrails, very important. Very, very
Yeah.
important. Yeah.
Yeah, within, when we become healthcare providers, whether it's medicine or dentistry or vet school or whatever it may be, we learn so much and we forget so much, but somehow sensitivity and specificity are one of those things you learned in high school and undergrad, and even now it's like, oh wow, that was like a really important concept that I still need today. My So we've talked about the image analysis technology, the ambient technology. What are some other kind of offerings you have? I know you have some stuff that works with insurance companies and billing, and in that world, if you briefly want to touch on that as well.
Yeah, I would say, if you look at the spectrum of the dental delivery system, there are two pain points, if you will. One is between the provider and the patient, in a sense, like, is there disease or not? And I talk how this, technology is helping address this. It's a source of, a third independent way of looking at the image and sort of say, yep, this is the disease, let's make a plan, right? But the second one is between the provider and the payers. And this is not, again, for, you know, it originates from the same space that two dentists can look at the same X-ray and make different decisions. And so when you're submitting something for pre-authorization, right? Again, if you don't have a standard or validated way, you can get different decisions, right? I could submit it, and depending on who reviews it, they're like approved, or someone else can review it and they're like, denied, like I didn't. And so I think solving for that second piece, where providers and payers need to agree if there is, a certain level of disease or coverage is provided, because they have very clear criteria, right? For some of them, it's like, you need this much bone loss for me to cover this, or you need, I don't know, this much of the crown to be missing so I could cover the crown. So if we figure out, and we have this technology to be that sort of independent, no one knows it, right? The payer doesn't own it, the provider doesn't own it. It's like this independent, FDA-cleared source of truth. Then guess what? It really removes that tension, because we have payers who are like, well, if the Overjet annotation says that it's meeting the criteria, it's automatically approved. I mean, think about the burden that's left, removed from the provider to get that authorization and approval. So it's really exciting to see that, and the providers and the payers are recognizing the power of this.
Yeah, and I think
And
it's
I
so
would just say
powerful
one
that
thing is gotten kind of bad rap around automatic denials, right? That this is never the case. Automatic approvals, and if it's not sure, you gotta find a human. You gotta have a clinician review it. So that's a really important concept here.
absolutely, I love it. I obviously everything that's been in the headlines within, insurance and AI is usually the insurance company owns the AI and the algorithm, and they're usually, a lot of times, unfortunately, using it to deny claims. And the fact that this is independent and, like you said, payer doesn't own it, provider doesn't own it. It's just like a judge and arbiter saying like, hey, these are the criteria, this is what I'm seeing, and these are the facts. And so I think that makes it so powerful. The I guess my final question will be where are you most excited about? Obviously, we've talked about a lot of exciting things. Where are you most excited about what's going to happen like in the next 5 years when it comes to dentistry and AI and innovation?
Two things. We have an access to care challenge, and this is across the board medicine and dentistry. I hope that with the efficiency this provides with provider and the burnout and the time it saves to diagnose things, that, we will be able to improve the access. To me, that's ultimately an incredibly important goal, is that people get the care they need. And then I would say the second one where I'm really excited is we are missing the common language with medicine. And I hope the findings here, it's like, I don't know if it's an oral health score. We don't have time to talk about it. Overjet has created this. Like, we need a common language. And I hope AI would be that common language with the rest of medicine. It's like, hey, here's the burden of disease. The same way what your A1C and what it is for, diabetes. Let me give you an oral health score. So you just have a sense like, this patient has a lot of infection. You may not be able to do anything about it, but if you don't know that it is even there, how do you manage the patient, right? And so finding that common language between dentistry and medicine, I'm genuinely excited. And I think ultimately this will improve outcomes across the board, not just dental outcomes, but I think overall health outcomes.
Yeah, absolutely. Like you said, I, you know, practically fly blind when it comes to someone's dental health, but I can look at every other record about every other system, and you know better than me, but I just know on a very basic level that we're finding more and more how dental health is related to like Alzheimer's risk and heart disease risk and like a variety of other things. So the body's connected. Just because we as humans separated into like dental medicine and other medicine doesn't mean that the body's still not interconnected. So yeah, that really is like a future to look forward to where we're actually looking at everything within one picture and doing the best thing that's for the patient. Thank you so much for sharing your experiences and the amazing things you all are doing at Overjet. Really, really enjoyed my time with you.
Thank you so much for having me. Have a great day. Thank you.
You too. Bye.